everyone. On the behalf of Voice of Healthcare and Viatris, I welcome both our guest speakers and attendees for this panel discussion for breast cancer awareness, which is a series of virtual dialogues that's powered by Viatris. The topic of this session is screening and diagnosis of breast cancer in India. And for this discussion, I have with me two very renowned experts in their field of practice. First up is Dr. Lalit Mohan Sharma. Sir is a senior consultant hematologist and medical oncologist at the SriRam Cancer Centre, Mahatma Gandhi Medical College, Jaipur, Rajasthan. And then up we have Dr. Manish Bhatia, and Sir is the senior cancer surgeon in Inlaks and Budhrani Hospital and is based out of Pune. While sharing his expert views, Dr. Bhatia will also be leading this conversation. So, without any further ado, I'll just hand it over to Sir to start with the discussion. So, Dr. Bhatia, over to you.
Thank you, Khushbu, for your kind introduction. Welcome, Dr. Sharma and other attendees who are on the show. So, as we all know that this month is considered to be observed as a breast cancer awareness month. So, October particularly every year. So we thought that we'll participate in this community activity of disseminating information about breast cancer and, if possible, motivate people to, know more about, educate about the breast cancer and things like that. So we'll start with identifying the problem. What is the actual status of the problem in our country? Uh, as we all know that the breast cancer incidence is much, much, much more, about 5 times more in Western countries compared to India. So why are we emphasizing about a disease which is not so common in India compared to Western countries? Dr. Sharma, your views on this, please?
Yeah, I think Dr. Bhatia, that is very relevant point we are discussing today, and the major emphasis is on that. What is the need of celebrating this breast cancer awareness month? So if you see the reality, of course, the burden is less in India as compared to the Western world. But if you see the mortality, it means the number of cases dying as a result of breast cancer is much higher as compared to the Western world. In Western world, we see that most of the cases they are being detected based on mammogram. So early stage detection is very common with them, and they are able to detect tumors of less than 1 centimeter, few millimeter tumor they are able to detect, and that leads to cure rates of more than 80%, 90% in majority of the cases. While in the low and middle income countries like ours, most cases they come in stage 3 or stage 4. So the overall outcome remains poor despite having extremely good surgical skills, chemotherapy drugs, radiation machines. The outcome is not very good here. So there is a strong need that we focus on early detection. How can a lady be aware about the breast cancer symptoms, and what could be the advantage based on this, and we will be able to save a lot of resources, in fact, if we detect them early. So of course I agree that the burden is low as compared to the Western world, but the mortality rate is quite high. And in
Right.
India, we are seeing that in most of the educated community and in most of the metros, now we agree that breast cancer is number one in the overall cancer in the women, and this is rapidly, in fact, exceeding the number of
Increasing.
cervical cancer cases.
Right. So, as Dr. Sharma correctly mentioned, that the burden of cancer is low at present, but increasingly, and in near future or in medium term future, we are going to see a lot more cases of breast cancer. So, now early detection and screening. The Western countries have screening programs where, starting at a earlier age, about 35, 40 years, they start to undergo mammograms. But in our country, the problem is that, apart from the metro cities and some tier 2 and tier 3 cities, mammography is very rarely available in if you small towns, mofussil towns. So, what are the other methods of early detection, Dr. Sharma, would you recommend for women in our country?
In fact, you rightly mentioned that the mammography facilities, they are hardly available even in majority of the cities. If I talk of my state in Rajasthan, we have 33 districts and the mammography machine is hardly available in less than 10 cities in fact. So majority of the district in most of the states of the country, mammography machines are not available. And second thing,
Right.
the way the Western world is doing that, it is compulsory mammogram of each female is not practically feasible because of the resources and because of the educational level of the society. Even in many cities where the mammography machines are available, the females are not aware that what with this machine benefits them. So even we are having a machine, but the females are not going for the screening part. They go only when some symptoms are there. So the
Right.
screening looks to me very, very difficult in our scenario. And I feel that the most important point here remains that the lady should be aware of her own breast. So if we promote of breast health, if the lady is aware of her own breast and if she can detect any changes in the normal breast, she will be able to pick up some changes which may or may not be a cancerous tumor. So I think breast self-examination, awareness about her own breast, these two remains the major key lessons for our common women.
So,
Uh,
would you, sir, elaborate on what is exactly you mean by breast self-examination?
Yeah, I think breast self-examination, lot of videos are available on YouTube. And breast self-examination is that 5 days after the periods are over each month, the lady undergoes her own breast examination by herself. So there is definitive technique. It takes hardly less than 5 minutes in a month, and the lady, after taking a bath or in her private room, she can do the self breast examination. So there is particular method and the chronology that how the lady should palpate her own breast, how she should palpate the axilla or the armpit, and she can notice any changes. So I think in country like ours, if the lady can be aware of her own breast, then any changes can be picked up, which are very well depicted in the pictorial outline of the things, as well as various YouTube videos are
Videos
available.
also, right? So, any particular age group would you suggest when the lady should start this self breast examination?
I think that is also very relevant that in Western world the breast cancer happens in around the age of 50 years, but in our country we are seeing most cases in 40s. So we are in fact 1 decade earlier in the breast cancer incidence as compared to Western world. So our female
Right.
should undertake the examination around the age of 40 years. And each month she should do. And other thing, if some lady has got a family history positive means her mother, her
Right.
sister, her maternal aunt, her nanny, if any of them have undergone any breast cancer treatment or any ovarian cancer, then it becomes 10 years earlier. So such ladies with strong family history should undergo the breast evaluation 10 years ago. So around the age of 30 years, these high risk females should start this screening. Screening means breast self examination, they do it, and with high risk features, high risk family history, they should report to the clinician. And of course, the breast self examination is not a substitute for clinical breast examination, but of course, this remains very important that we teach them about breast health. And I think in the breast cancer awareness month, if the lady can be made aware of her own breast, it will be a great achievement by all of us.
All right, sir. So, sir, apart from the family history that you have mentioned, which increases the risk of breast cancer in a particular lady, are there any other risk factors the general population should be aware of so that they can take their issue of breast cancer a little more seriously than regular population?
I think that is also very relevant as most of our patients, whenever the breast cancer is diagnosed, the lady comes and say that I don't have any risk factor, I don't drink, I don't smoke, I am a very pure vegetarian, I am a very sattvic kind of and very kind-hearted person, I did not do bad for anybody. So the breast cancer risk factors as per the available literature are: one, being female itself is a risk factor. Second thing,
Right.
as the age advances, the breast cancer or any other cancer's risk keeps increasing with increasing age. Other than that, we can see that obesity, high fat diet, physical inactivity, these all contributes towards development of breast. Previously, we were having the females where the marriages were happening in early age, many times even in late teens or early 20s. So they were
Right.
having more children. So less number of children and more of use of these electronic gadgets, hormone replacement therapy. So all these things puts them at higher risk. So nowadays the age of marriage is higher. So lady gets married in late 20s or 30s. So at that time they have less number of children also. Lack of breastfeeding also puts them in high risk. So because of the job profile, because of other reasons, the lady is not able to breastfeed the child. So all these are in fact risk factor, which are soft features which most of us we try to teach the females. Any other additional point, if Dr. Bhatia you can add to this?
I would like to add about one thing: alcohol consumption rising in the society, but it also contributes to breast cancer risk. Second thing is that although hormone replacement therapy increases the risk for breast cancer, at the same time we must emphasize that current day oral contraceptive does not increase. So
Absolutely right.
that, yeah, so we should not be giving a idea about the hormone therapies. One more thing now. Suppose as a lady, I know that my Mausi and my Nani had cancer, you know. So
Mhm.
how does that increase my risk? In the sense, is there any test which I can do or check whether I have an increased risk of breast cancer, or just I have to assume that there is an increased risk? Are there any tests available for that? And how do we do that?
I think that is also very, very relevant in modern days, that the breast cancer hereditary risk factors. So if somebody, some ladies, mother had breast cancer, her first degree blood relative, so mother, sister, or nanny has got breast cancer and or ovarian cancer, then the genetic predisposition becomes higher. If some lady develops a breast cancer today and after say few years she develops breast cancer in opposite breast, that also becomes a high risk for possibility of genetic mutation. If lady develops a breast cancer today and after few years developed ovarian cancer, that also becomes a high risk for having a genetic transmission. If a lady develops breast cancer before the age of 40 years, this also may be a reason for the genetic risk factors. So any of these features, they guide us that there could be possible genetic mutation defect which is traveling from one generation to another generation. Yesterday only I had one lady whom I have treated some 15 years back for breast cancer. This lady had breast cancer, then she had a lot of complications. Now her daughter, at the age of early 30s, she is married, and now after 15 years of death of her mother, this lady is now having breast cancer, in fact, and the genetic predisposition becomes one factor responsible. So if we detect such strong family history, we can do the testing, the genetic testing, which is done in the tumor tissue. So whatever the biopsy has been done from the cancerous part, we can do genetic testing, that is BRCA1 and BRCA2 gene defect on that sample, and that tells us that this lady is carrying a genetic mutation defect or not. The advantage of doing so is that we are having one particular drug available which targets against this, and that leads to more protection. Other is that if somebody is carrying a genetic mutation, her sister, her daughter, her close or first or second degree relatives on the maternal side, they can undergo a breast cancer or ovarian cancer screening. Screening means they need to go to a doctor, they need to do the regular screening methods like mammogram is available, ovarian, for ovary we do a sonography of the abdomen. So they need to undertake these examinations in a very meticulous way. The advantage of that anybody carrying the BRCA1 or 2 BRCA mutation does not mean that that lady will develop a breast and or ovarian cancer in the lifetime. The advantage is that if this lady becomes more aware about the early detection methods, and if she goes regular mammograph, regular sonogram, then cancer can be picked up in early stage. And if you pick up early stage cancer, the cure rates becomes higher. So that
Right.
becomes the importance of BRCA1, BRCA2 genetic testing. And especially we all know about the Angelina Jolie effect, that once the film actress was
Right.
diagnosed with this, and then she has undergone bilateral breast removal surgery, and the BRCA1, BRCA2 came into picture too much, in fact. And now we are seeing lot of cases coming to us with family history positive. At our center, we have a separate genetic clinic where we assess the risk. And the BRCA1 and BRCA2 gene defect not only puts the lady at higher risk for breast and ovarian cancer, but the male persons are also at higher risk in that family. Say example of prostate cancer, pancreatic cancer, and few more cancers. So the person carrying the genetic defect, other brothers and sisters may be at risk. So that remains the advantage of testing for this genetic test BRCA1 and BRCA2. Any other additional point, if Dr. Bhatia, you want to
So,
add here?
just one thing that this BRCA and BRCA2 tests are not now the costs have come down. They are
Absolutely.
done on a blood sample or oral swab, and the reports are available in 3 4 days. But here I would like to caution that people or persons who are not having cancer before undergoing any sort of genetic test should undergo genetic counseling, understand the implications of getting the test done, because it is not easy to live with the knowledge that sometime in future he or she might get a cancer. So counseling is a must in that manner. And if the test comes positive for a particular person, what are the options that they must understand first before undertaking any genetic testing on their own? It should always be in consultation with your doctor.
I think that is very,
Am I
very
correct, Dr.
relevant.
Sharma?
Yeah, I think that is very, very relevant, that the genetic testing does not mean that if something is available test on blood, then everyone can undertake that. It's not like simple CBC or blood sugar. It's a very, very serious test. So we should consult the doctor, genetic clinic, genetic counseling, and do it only when strongly recommended by your doctor. And we should be prepared for the consequences, that if it comes positive, the science does not have any treatment. Science can only predict that this positive person may be at risk of having breast and or ovarian cancer at a later stage. So again, we need to be very cautious about these issues.
So, this is for till now we have discussed about the diagnosis and detection and early detection. Dr. Sharma, I would like to emphasize something about when to consult a doctor, when a patient should consult a doctor, what changes or what symptoms or what signs do they find that should prompt them to see a doctor about breast cancer or generally anything related to breast.
Yeah, in fact, so commonly we keep a poster, and whenever we deliver any talk in the public for females, we keep these things in mind, and we generally teach them any difference in the size and shape of the breast. So if the lady feels that something is abnormal, either the breast has become more bulky or the breast is D-shaped as compared to the previous one, so that can be a symptom or sign. Other thing could be that if some lady can feel a lump in the breast, so all the lumps will not be cancerous. In the young age, 2 out of 10 is likely to be having a malignancy, and 80% will be benign. In fact, if you see young age like teenage or early 20s, but we don't want to miss those malignant lesions. So any lump in the breast or in the axilla is this armpit. So in lump in the lymph node in the armpit along with lump in the breast or tumor in the breast becomes strong suspicion. Anybody having a recent retraction of the nipple, so nipple is going inside, so that also recent change puts us a risk factor that it could be a cancerous changes. Anybody having a bloody discharge from the nipple, so if a lady feels that she is having some blood spot in the bra along the nipple, so that could be a sign of carcinoma or cancerous tumor. If some lady feels that there is some eczema like thing near the areola and the nipple, this could also be a sign of breast cancer. So these all we promote that any change you find from normal to abnormal, it is always good that it should be seen by the doctor, it should be examined properly, and then evaluation should be done. Common mistakes the females do is they have got a tendency for self neglect. The lady feels that no, this is not a problem, why should I go to a doctor? And many times they will see some nearby, some other females, some other staff nurse or here and there, and if somebody tells them that don't worry, there is no pain, so you should not go to the doctor. So
Right.
commonly the cancerous tumors are painless. Other than that, if some lady feels that suddenly the breast has turned into a stony hard, or if the it has become red hot and the it's like a orange peel appearance, that also can be a manifestation of breast cancer. So any of these symptoms, we advise them to take help from a medical professional, to go to doctor, get clinical examination done, and then of course the relevant investigation should be
I would just like to emphasize here that pain, uh, generalized to swelling of the whole breast, or sometimes you can get swelling of the same side of the arm. So these are little late symptoms. Better not be reaching at that stage to consult a
done. Right,
doctor actually. So
right, very
from here, I would like to just explain what happens when you come to the doctor. Being a surgeon, most of the patients come to me, and so I would,
yes,
if you don't mind, Dr. Sharma, I would explain how what is done once the patient comes here.
definitely, sir. Yes, sir.
Right. So after a thorough clinical examination, uh, and your doctor or your surgeon will advise you to undergo a tissue sampling or a biopsy. We call it a biopsy of if there is any mass or lump is there or felt. So what is a biopsy? In biopsy, we either take some cells or a piece of tissue from the lump and examine it under the microscope. Now, there are three or four types of biopsies. One is we do it with a very fine needle, a routine needle which is used for injections. Similar fine needles to take out some cells, put it on the slide, put them on the slide, and examine it under the microscope. This gives a result faster, but it doesn't give a detailed explanation about the cancer. Second is we put a needle which is a little larger needle. It's called a gun biopsy, and we take out a piece and send it for uh, microscopic examination. This takes about 3 to 4 days. Sometimes it may take up to 7 days in some areas. This gives us a little more detailed information, like what type of cancer it is, and how aggressive it is, what is the grade of the cancer. All those things, diagnosis or information is available on that. Sometimes, if you have something detected on mammography only, or sonography or sonomammography, which is not palpable by hand, so in that case, doctor will advise you to undergo a sonography or mammography guided biopsy, where the mass or the lesion is looked under the ultrasound guidance, and the needle is inserted and the sample is taken out. And the last, sometimes after having a multiple attempts at needle biopsies, sometimes we are not able to get adequate sample, or the target is missed, or so that, or the lesion is very small which cannot be targeted by needles. In that case, sometimes the doctor might offer you to directly undergo a incisional or excisional biopsy, where a part of the tumor or the whole of the tumor is taken out. But this is a very, very rare approach and should not be opted for as a first approach, because that distorts the whole further management of the cancer. Dr. Sharma, would you like to add something to this regarding
Uh,
diagnosis?
Yeah, I think very well mentioned. And in fact, the females are too much worried, especially with the Google era, that whenever they
Right,
see any lump, they will first go to Google and ask Google doctor that what this could be. And the Google tells them 10 differentials, in fact. And the cancerous looks most frightening to them. So whenever they come to us, they have got a fear that whether my tumor is cancerous or not. So the best way to tell them is doing a biopsy, but again, based on the radiology, based on sonography, based on mammogram finding, it gives a good clue that it could be a cancerous or non-cancerous. So every tumor does not need a biopsy unless it is strongly the radiologist guides that it could be a cancerous tumor. Other thing, Dr. Bhatia, I would like to share that many patients, I'm working in Rajasthan, so most patients, they have got a fear factor that the moment you touch cancer with any needle, it may spread. So the first
right.
thing they ask कि सर बायोप्सी करने से तो फैल जाएगा कैंसर. So that remains a very strong myth. Unless we do a tissue diagnosis, how can we be sure that the tumor is cancerous or it is non-cancerous? Other important point by doing biopsy, that surgeons like Dr. Bhatia, in one sitting they can see that also under my in the frozen section in the pathology lab, and then they can do the surgery, completion surgery, even if it is cancerous. So
Absolutely correct.
my take home to most of the viewers will be that do not get afraid of a biopsy. In fact, rather you should go ahead with biopsy if your doctor is feeling so. Dr. Bhatia, one small question I would like to ask you to clarify to our audience. There are three
Right.
methods. One is sonography, sonomammography, other is mammography, and third is the MRI. So can you tell us
Right.
clearly that which modality is useful at which age and what are the plus minus points?
Okay. So I would say that for 90% of the patients, mammography or sonomammography is sufficient for diagnosis and taking the treatment forward. Now, let me explain the difference between mammography and sonomammography. Uh, for a premenopausal patients or patients who have not are still continuing to have periods, it is the breast is better visible on sonography or sonomammography instead of mammography. Mammography relies on the presence of fat in the breast. So after the menopause, the fat in the breast increases. So mammography is useful more after patient has achieved a menopause. Second difference is mammography is done with the help of a very low dose X-rays. Earlier, there was a myth about it that the X-rays or repeated mammograms it themselves cause cancer. But now that the dose per mammogram because of the radiation is so low that that risk is eliminated. Or third thing that mammogram also sometimes show something called as microcalcification, that is the involvement of the rest of the breast is there or not. So that will also determine whether patient can be treated with just the removal of the lump or whole breast needs to be removed. This particular sign is not easily found on the sonography. So mammography and sonography have both important and both have their own important needs to be done when for the patients. Now coming to mammography. Mammography per se is used in very rare conditions where there is a high suspicion of lump being there, but it is not being detected with sonography or mammography. So ultimately, as I said, it's very rare to use mammogram, and MRI is not very easily available. Forget the Mofussil towns or tier two, tier three cities. Even in metros, mammography or MRI for breast
MRI,
is
MRI breast.
very less available, very less.
I think that is very, very right that in the postmenopausal, after the periods have stopped, mammogram or mammography remains good option. But for young females, the sonomammography in fact can pick up most of the lesions. If mammogram is not available, facility is not available in your city, it does not mean that sonography gives you very, very inferior results. Sonography, in the experienced sonologist, can also guide us about the tumor size. The advantage of doing this sonography and mammogram is, if a tumor is there, say today it is 2 centimeter, we can keep a track also that what is the rapidity of growth, how are the margins of that. Dr. Bhatia, one more question here, for which many females come to us during a camp. They have got a severe breast pain and they say that they need to take medicine. And many times they come and tell us that is it cancer or no cancer. And they, on examination, there is nothing. Mammogram says nothing. Sonography says nothing. So, how do you handle such thing? Because they have got a fear factor of cancer.
Right. So, when patients come to us with just the pain in the breast, usually it is on both the sides, and also we ask them whether it is related to their periods or not. We call it cyclical or non-cyclical mastalgia. Most of the pain which is not related to the periods is of inflammatory in nature, I mean benign in nature, in the sense that some small infection or inflammation somewhere in the ducts of the breast causes the pain. A simple sonography can help us identify not only the cancer conditions but other benign conditions also. And the treatment is given in the form of reassurance or just simple analgesics and things like that. As far as cyclical mastalgia is concerned, there are some medicines like evening primrose, vitamin E, which offers benefits to certain number of females, not everybody. About 70-75% of females benefit with this medicine, and others sometimes they have to just be reassured and take painkillers whenever the pain is severe, and rest of the time just carry on with their routine work. So, and probably tell them that once your menses stop, the cyclical mastalgia will itself stop.
So,
As we
Dr.
were
Bhatia,
mentioned earlier, pain is not the early symptom of cancer. Pain is a late
yes.
symptom of cancer.
Thank you. Thank you so much for such a elaborative discussion on the pain in the breast, which remains very, very common, and females are shy
Right, sir.
to share with anyone. Dr. Bhatia, we have discussed adequately about the various screening and diagnostic early detection methods. So, since you are a surgeon, so once the diagnosis based on the biopsy, it is confirmed that this is cancer, the lady has got a strong fear. First fear, whether my life will be saved or not, other whether my breast will be saved or not. So can you highlight the various surgical methods and the advances you all are doing these days for the breast cancer patients?
Sure. So once a diagnosis is made, the next step we do is to check whether the cancer is limited to breast, or it has spread to axilla, or it has it spread to any other part of the body. So once that is determined, and on the test it is found that it is limited to either breast or at the most breast and axilla, then most of the time the first treatment of choice is surgery. Now, surgery is done in two ways. One is that you just remove the lump with the margin of normal tissue around it, so that we are sure that the whole cancer has come out of the body, and we check it while the patient is still on table. That is by something called as frozen section, and then by a separate incision we uh, remove the or clear the armpit or the axilla of the lymph nodes. Earlier, we used to clear all the armpits irrespective of whether it has spread or not. But now, if there is no obvious spread in the axilla, then or armpit, then we take one sample of one or two lymph nodes and assess it on table on examination, frozen section examination. And if there is a spread in the axilla, then only we remove all the lymph nodes in the axilla. The older method of treatment used to be complete removal of breast and the tissue in the axilla. That was called mastectomy or modified radical mastectomy. Now there are some criteria where you can do a mastectomy or whether you can do lumpectomy or save the breast. Sometimes, if the tumor is too large compared to the size of the breast, then we have to sacrifice the breast. But nowadays, with current methods, we can even do what is called as neoadjuvant chemotherapy. We shrink the tumor with medicines, drugs, injections, oral medicines, depending on the individual patient, and then offer uh, breast conservation or preservation of the breast in those patients. So broadly speaking, two ways: either remove the lump or remove the breast. But nowadays, most of the doctors try and preserve the breast so that the normal cosmesis is maintained.
I think that is very, very relevant and very important for all the females to understand that the breast cancer does not mean removal of breast. Most of the surgeons, like Dr. Bhatia sir has rightly mentioned about the breast conservation surgery, we remove only the tumor tissue and the whole breast is left behind. So that gives the normal appearance also. Even if the breast has been removed for any region, then we have good plastic surgical techniques available by which the mammoplasty or the breast reconstruction can be done. Or otherwise, if the lady is comfortable, then the post mastectomy bras are available, so the silicone prosthesis can be wear from the outside also. So these are the methods. And like Dr. Bhatia has mentioned about, if somebody has got a tumor which is large, in that case we give neoadjuvant chemotherapy. So we give some chemotherapy injections and then we do a surgery later on once the tumor size has regressed, and the breast tumor which was large, now it shrinks to a small volume, and then we can do a surgery and the whole breast can be saved. So these are various newer techniques, not only in the surgical technique but in the chemotherapy part also. And in few of the tumors where the HER2 directed therapy we call, in fact there are adequate drugs available to us where we can remove, where the whole tumor can be in fact pathologically it can be cured in fact. And many times when the surgeons operate upon, they find that there is no residual pathological specimen or pathological tumor left over. So we can shrink the tumor with available methods, and then there are surgical techniques, and of course the radiation techniques are also rapidly evolving. And nowadays we have got extremely good, very sensitive radiation machines which can target the tumor, and there will be very, very minimal side effects. And of course, based on the pathology report, we have various options of targeted therapy, chemotherapy, hormone therapy. So all these are being done based on the pathology report, based on the hormonal status of the tumor, based on the menopausal status of the female. So I think at this point we should be very clear that whatever your doctor suggests, you need to follow his advice, and you should not have a myth that my cancer will be spreading by touching and by doing a biopsy. Dr. Bhatia, any other points you want to give message
Dr.
to
Sharma,
our?
I would just like you to elaborate a little on side effects of chemotherapy because that is a thing which most of the patients are quite afraid of. Why do chemotherapy side effects occur and how, is there any strategy to mitigate them? How are they temporary or permanent in nature and things like that?
In fact, that is very, very relevant that whenever a patient comes for chemotherapy, of course, everybody's mind is that whether I will be able to tolerate the side effects or not. So the side effects are mainly two types. First is early side effects and other one is the late side effects. So early may be initially in 1 week, the female may have, the lady may have some vomiting, constipation, abdominal discomfort. All those can be in initial 1 week. and subsequently there may be a difference or there may be alteration in the taste. After 3-4 weeks, most of the chemotherapy that leads to hair loss also, because the basic working principle of chemotherapy drug is that it acts on the dividing cells. The breast cancer cells are dividing. So whatever tumor has been removed by the surgical methods, even after that also some cells are remaining in fact, and they can lead to recurrence of the tumor. So there are side effects which are because of the damage of the normal dividing cells. So hair loss can be there, and these all are temporary thing. And of course, more and more we keep checking that if somebody has got pre-existing diabetes, neuropathy, then some other neuropathic side effects may be higher. Otherwise, if the kind of doses we are using, the kind of drugs are available, most of the drugs are very safe and they are life saving. About the hormone therapy part, of course, these are tablets available given to hormone receptor positive, which constitutes more than 30% of our patient, and that is to be given for 5 to 10 years. So my suggestion will be that do not miss your doctor's advice. Do not feel that once the surgery has been done, then all the treatment is over. Keep regular follow-up with the doctor so that they can monitor the side effect related to the treatment, as well as some chance of recurrence is always there, so they can monitor for both.
Thank you, Dr. Sharma. Dr. Sharma, if there are any questions from the viewers that we can take, or otherwise we are out of time, we should wind up.
Yeah, I think we can take up, but can Khushbu help us for seeing any questions
Yeah,
if
if
there
there
are?
are one or two questions, important questions, I think we have covered most of the topic, but if there is anything.
Khushbu, are you there? Can you see any questions?
Hi, sir, I'm there, and I would suggest I think we have covered up most of the questions, so it's better that we probably can wind up. So, because most of the public awareness questions have been taken up already. So,
Right.
Right.
Dr.
So I
Bhatti, I
think,
think we can wind up.
So,
yeah, Dr. Bhatia, message
Dr.
from your
Sharma,
side.
it was wonderful speaking to you, and hope we meet again sometime. If not virtually, then maybe physically also.
So Dr. Bhatia, before we leave, your last message to the audience.
My important message is that we should, as a lay people, get yourselves educated about breast cancer and take steps, if not prevent it, because many of the risk factors are non-modifiable. But if we find ourselves in a situation where it is likely that somebody is having a breast cancer, then at least we should strive to get it treated early to get the maximum benefit of the current knowledge and the treatment available uh, in the medical field.
Thank you so much. And from my side, I think my message will be that be aware of your own breast. Breast cancer is not a fatal disease. Cancer is highly curable, and early detection cures the cancer in maximum of the cases. So let us put our full efforts for early detection, high cure rates, and save lives of most of us. Thank you
Right.
so much, and thank you, Khushbu, for giving us
Thank you,
opportunity.
Kushbu.
I'm I'm thankful to Voice of Healthcare and BTS for giving us an opportunity to interact with you all. Thank you.
Thank you.